Hey guys, it's me Brian. We're back for another video segment. So before we've gone over upper cervical, mid cervical, lower cervical spine, thoracic spine, now we're going to finish up on assessing the movement of lumbar spine. So lumbar spine, we are going to start by assessing flexion, extension, lateral flexion to both sides, and rotation. So for this first movement, I'm going to assess Ryan's flexion. So for this, I'm going to tell Ryan, can you please go down and touch your toes? While he's doing this, I am watching the way that he's moving. Do you have any discomfort with this?
No.
Good. And can you come back up for me? The second time, I'm going to cue him to go down, but I'm going to have him go down segmentally. So I'm going to say, Ryan, can you tuck your chin in and slowly go down, all the way down, touch your toes. There we go. Ryan, do you have any discomfort with this?
No.
So now I'm going to apply overpressure. When applying overpressure, I'm going to do it directly over the top part of his back and press down. Do you have any discomfort?
No.
Okay, and come back up. Nice. So next I'm going to assess Ryan's extension. So for this, I'm going to tell Ryan, can you please bend backwards as far as you can for coming from your lower back? Do you have any discomfort with this?
No.
Perfect. So you can come back up straight. Now we're going to do the motion one more time. But this time I'm going to apply a little bit of overpressure. Ryan, can you do that motion again? Good. Notice I'm supporting him and applying a little bit more pressure and come back up. One thing I want to watch out for is his knees. I don't want him to get this motion from bending his knees or really leaning forward. Next, we're going to do lateral flexion or bending to the side. So Ryan, can you put your hands on your side and bend all the way over towards me? Do you have any discomfort with this?
No.
So now I'm going to wrap around. I'm going to support Ryan at the waist and push him a little bit more. Noticing the infill. Ryan, can you come back up? And we're going to assess the other side to see symmetry of motion. Ryan, can you bend to the side for me? Great. So I'm supporting, applying a little bit of pressure through there. How does that feel? Any discomfort?
No.
Okay. Next, we're going to assess his rotation. So for this, I'm going to say, Ryan, turn towards me. One thing to watch out for is to make sure his hips do not move so that it's purely from his back. So for this, I'm going to stand next to him and block him. Ryan, you can return back to the middle. Right. Turn towards me, so I'm blocking him with my hip. I'm supporting him at the waist, and then I'm rotating him towards me. Any discomfort?
No.
Perfect. Now we'll try the other side. So again, I'm getting here. Ryan, can you turn towards me? Good. Up. And here. Rotate on. With this hand, I am grabbing onto his pelvis or his ASIS to make sure that it stays forward and then pulling him forward. That's all I have for this segment. So we assess flexion, extension, lateral flexion to both sides or side bending, and then rotation to both sides. Thank you for watching. Tune in for the next section. Hi guys, Brian here again. So in this section, we are going to again watch Ryan go down into that forward bend or flexion of the lumbar pelvis. But this time we're looking to see if he does any compensatory strategies. So for this, we're looking for reversal lumbar pelvic rhythm. We're looking for growler's sign, and we're looking for instability catch. So for this, first I'm going to get Ryan to go down. So Ryan, can you go down into flexion? Or can you touch your toes? And can you come back up? So while he's doing this, I am watching his pelvis and his trunk movements. So the normal flexion should be led from the chest and then the pelvis follows. So if he had an abnormal motion, he would, as going down, the motion would be initiated from the pelvis first and then the trunk would follow. And then when coming up, the trunk would go up first, and then the pelvis would follow. Ryan did not have this. Growler's sign would be, as he's going down, he goes down normally, but then he has to walk his way up with his hands. So I was watching Ryan's hands too to see if they just nicely went down to the ground and came back up. Lastly, I was looking to see if Ryan, when he came down, had to put his hand on his back in pain. That is another sign of a compensatory method. So when watching a patient go down to flexion, it's important that we watch for multiple signs of compensation. These can be pieces of the puzzle to help us figure out what's going on with the patient. Well, that's all I have for this section. Thank you. Hello, Brian here again. So for this section, we are going to do something called the Gillette test. Originally, this was thought of as an SI assessment, but we are assessing it for motion of the lumbar spine. So for this, I am going to go down to eye level with Ryan. I am going to palpate to find his PSIS on both sides. And then I'm going to come, found it. I'm going to come straight to the middle, and this is around S2 level. So for this test, I will have the patient march, but I want one finger on that S2 region, other finger on PSIS. As he marches, I will expect the finger that is on the PSIS to drop inferiorly to the middle finger. So I'm going to ask Ryan, can you please lift this leg to 90 degrees as if you're marching? So while he's doing this, I am watching my fingers to see if it drops lower, and it does. Perfect. You can take a break. So now I'm going to shift over, find the PSIS on the other side, stay on that S2 level, which should be aligned with the PSIS. And Ryan, can you lift up this leg for me to 90 degrees? Good. And control back down. Good. You can relax. So during this test, I'm looking to see if the pelvis tilts posteriorly as he lifts his leg. So Ryan had great movement, but another thing to watch for is the speed that the patient does this test. So if they do quick movements down, that means they have some instability, and we should get to the bottom of why they cannot stand on a single leg. Well, that's all I have for this section. Thank you for watching. Hello, Brian here again. So this section we're going to, again, watch his lumbar spine through movement. So this is called a standing flexion test. So for this test, I am going to, again, go down, palpate to find his PSIS. So if you have trouble finding the PSIS, find the iliac crest, come medially, and then inferiorly until you find it. So if you go down too low, or you could start low and then work your way up into it. So I have located them both. So for this test, I'm going to tell Ryan to do that forward bend or the flexion as before. Can you please do that for me? And this time, I'm watching my thumbs, and can you return back? To see how my thumbs move during this flexion. So it is expected that as Ryan bends down forward, my thumbs should move up anteriorly or go forward with it, symmetrically. So that's all I have for this section. Thank you for watching. Hi everyone, Brian here again for another skill. So today we are going to learn how to do, how to quantify that flexion and extension and lateral flexion that we learned in the previous segment. So we're going to use dual inclinometers. So we use two inclinometers to determine how much motion is coming from the lumbar spine and how much motion is coming from that thoracic area. So for this, I will have my two inclinometers. I will zero them out on a level surface. The landmarks I'm using for this is Ryan's T12. So for this, I'm going to find the 12th rib and come in, and his S2. So I'll find his PSIS. I'll work my way in to find S2. So for this, I'm going to put my two inclinometers on him. Oop, oop. And the first skill we'll do is lateral flexion. So can you bend to the right side for me, Ryan? Perfect. And can you go back to the front? bend. Okay. Perfect. Next, we're going to do flexion and extension. So for this, I'm going to place both of the goniometers facing up. Show you this way, since I'm standing here. Can you bend forward for me? Perfect. And then can you come back up? And then can you, again, I'm going to shift the handhold. Can you bend backwards for me? So when patients go into extension, you can shift over the incline. Thank you. You can return that. Perfect. So when patients go into extension, you can shift the goniometer staggered so that they don't run into each other. So now I will take the two numbers that I got, I'll subtract them from each other to get the true range of motion from the lumbar vertebrae during flexion, extension, and lateral flexion. Well, that's all I have for this section. Thank you for watching. Hello guys, Brian here again for another test. So this time we're going to check the lumbar movement and stability during sideline hip abduction. So for this test, it's a little bit different. I want to make sure that the patient is as stacked as possible. So can you make your leg a little bit straighter? And I will instruct the patient to place their top hand on their rib cage and down on their abdomen. Are you comfortable in this position?
Yes.
So I will get at their feet to make sure I see a straight line. And I do not. There you go. So first I will show the patient the movement that I want. So this hip abduction, so you will lift your top leg up like this and down. During this test, I'm watching for the movement of the pelvis, okay? So Ryan, can you lift up your top leg and slowly control it down? And can you do it again for me? Good. So Ryan did a really great job. So this test is graded on a scale of 0 to 3. A 0 is normal pelvis movement. There's no falling. Just goes up and down with little pelvis movement. A 1, as Ryan lifts, we'll see a little bit of hip movement as he goes down or up. A 2, as he goes up, there will be a more noticeable hip fall. And 3, it's complete hip instability, so he will fall over like this. So it is important to watch this from multiple angles and make sure the patient's as straight as possible. Well, that's all I have for this test. Thank you for watching. Hi guys, Brian here again. So for this next section, we are going to check out the passive spring test of the lumbar spine. So if you remember back to the thoracic region, we assessed this for all 12 of his thoracic spine. So this time we're going to do his 5 lumbar spine. So to find the 5th lumbar spine, I am going to find his iliac crest, and I'm just going to shift in. That should roughly be where L5 is, palpating through. So for this, I'm going to use my hypothenar eminence. So I'm going to place that right on his spine. I'm going to have my other hand do all the movement. So that's going to cup over. I'm going to have straight arms protecting my biomechanics. And we're going to apply a little bit of pressure down and feel it come up. And then we'll shift up 1, press down, feel it come up. So when doing this, I want to make sure my arms are as straight as possible. And up here. So while doing this, I'm feeling for the return back up. So I'm pressing down and feeling for it springing back into my hands. So this we will judge by normal movement, hypomobility, so really stiff spinous process, or hypermobility. So that means that it goes down really quickly. It springs really quickly up. So excessive motion. So again, hypothenar eminence on the spinous process, L5 all the way up to L1. That's all I have for you for this section. Thank you for watching. Hello, Brian here for the last section. So this is the last test for our lumbar series, but also the last test for our whole spinal assessment series. So for this last one, we are going to check the intervertebral motion of the lumbar spine during both hip flexion as well as lateral flexion. So for this, I am going to support Ryan's leg. I'm going to cradle Ryan's leg, support it on my knee, and then I'm going to fill for L5 and the space between L5 and L4. And then I am going to bring Ryan's leg into hip flexion, filling for the gapping in between my finger. And then I'm going to move up a vertebrae, filling for that gapping. I'm going to move up again, filling for it. One more time. And then one more vertebrae. During this, I am filling to make sure that Ryan's vertebrae feels like it's opening up and letting my fingers go in, and then closing as I go back into hip extension. Next, we're going to test lateral flexion. So for this, I'm going to support Ryan's leg again on my knee. This time I'm going to hold him closer to the ankles. So I'm going to say, can you please relax for me? Let me control your legs. I'm going to fill again for the space between L5 and L4. I'm going to rotate him up and control back down. We'll go again. Again, third time. Time number 4. And then the last vertebrae. There you go. So for this, I'm feeling for an opening in my finger. For this, we would check, both of these tests, we would check both sides of the motion. But for this example, I'm only showing you one side. So we want symmetry between the sides. So that's all I have for you for our lumbar assessment, as well as our whole spine assessment. Thank you for watching. If you have any questions, comments, please leave a comment below. Stay tuned because we'll have many lessons coming up in the future. Thank you for watching. That's all I have for you. Brian at Regis University, signing out.